Jennifer, congratulations for being the 2009 greatest public service by an individual 35 and under.
Thank you.
And so talk to me about where did you go find the first person that needed eye help, and then where did you go find the first doctor and you linked them?
Well, when I initially thought of the idea for Unite for Sight, I thought there are so many people.
Unite for Sight. That's very
yes,
good. You say it so fast because you're used to it. So it's Unite for Sight. Go ahead.
Yes. So the organization is Unite for Sight, and the goal is to eliminate preventable blindness. And initially, I thought there are so many people who need eye care. How can we get them connected with eye doctors so they can have a complete eye exam by an eye doctor? And so I started as a student organization 9 years ago in 2000, and had gathered a group of students also to serve as volunteers. And I thought it's important to go to the community centers where people already are, as opposed to hoping that they would come to us. So we went into a soup kitchen, which was the location for the first screening, and then provided them with resources so they could get an eye exam through programs such as American Academy of Ophthalmology and American Optometric Association have available programs where their optometrists and ophthalmologists provide free eye care for patients, and it's just a matter of getting them to call an 800 number and get connected with the eye doctors for an appointment, and then they can have the same quality of care as any regular patient.
So you knew that was available through the doctors, and then you went to the soup kitchens to get the people who needed the help.
Exactly. So really raising awareness, making people aware of these resources that are available, so if they don't have health insurance, they can get an eye exam.
You're a very courageous lady. When you worked, and a lot of people don't get started with their idea because they sort of chicken out at the last minute. Were you a little scared going to the first soup kitchen and just walked in, and what did you say?
Well, I had contacted the soup kitchen in advance and told them about the idea to connect people with the resources, and they were very enthusiastic, and then on the scheduled day went with the group of students, the volunteers, to coordinate the screening and the education information.
Okay, and how did you corral your first volunteers?
It was the start of the academic year, so it was the start of my sophomore year in college, and there was a extracurricular bazaar, that it was called, where student organizations could recruit other students, especially freshmen coming in. So that was actually where I had recruited the first group of students and told them about the idea for the organization, and a lot of the freshmen were very excited and joined on immediately. And then we had the first vision screening shortly after that.
All right, now by the time you graduated from college, how big was Unite for Sight?
So for the first 3 years, and which was the time that I was a college student, it was about 35 student volunteers just within New Haven, providing services exclusively within New Haven. So it wasn't until after I had graduated that Unite for Sight then started growing, first within the US and then Canada and then internationally to Africa,
so help me out, because
Asia,
I'm sort of slow. So now you graduated in June, and probably your parents said they hoped you'd get your feet on the ground and go work for a bank. And you said, no, I'm all excited about this thing. And was that a significant life choice?
Well, yes. So I had decided that I wanted to grow Unite for Sight, and I also realized that at the time I needed a job as well. So I actually was a high school teacher while then growing Unite for Sight. So I had the full-time employment as well as full-time non-employment for Unite for Sight.
Stayed in New Haven?
It was actually, I was staying within Connecticut, about an hour from New Haven at the time.
And in your first year, after 1 year of effort, you were teaching. Of course, your first year of teaching, that's a lot of work too, because you got to learn everything. And then you're running this on the side. After 1 year, where were you?
So after the first year, we had about 40 chapters within North America.
Wow.
And
How'd you get your first chapter that wasn't in New Haven?
I contacted a lot of different universities about the student organization that I had started back 3 years before, and asked them to send out announcements to their students about the opportunity to start a chapter. And that's then how I was able to gather a lot of student interest on all these different university campuses to then expand the model from New Haven to many other locations.
Fabulous. And so now, after 1 year, you're on 40 campuses.
Yes.
After 3 years, how many campuses in the United States?
I believe it was about 90 chapters.
Okay,
at
and how
the
many
different
volunteers?
Campuses. Well, To date, we have trained 5,800 fellows, and after 3 years, there's probably about half that, because now it's been about 6 years.
Fabulous. And then how did you decide to go abroad?
And that was about 6 months into expanding Unite for Sight. I started getting people from Ghana contacting me saying that they have so many eye care needs and they had heard about Unite for Sight and asked if Unite for Sight services could be brought to their communities as well. And then I was able to connect with an ophthalmologist who was based in the US but had traveled to Ghana annually to work a lot with training the local ophthalmologists, and through him we were able to connect with a lot of the different local eye clinics, local ophthalmologists in Ghana, as well as India, and then now we also work in Honduras, so that we are able to support and assist those local eye clinics, those local ophthalmologists, to provide care within their communities.
Now, if you were talking to, which I'm sure you've done, to college students or high school students about basically think big and dream, and you really can be as big as your dreams. Many parents tell the kids to slow down, be less creative, get their feet on the ground, and don't think so big. So what would you do to encourage them?
I think it's so important if someone has an idea to go with their idea, take action, have passion, and really think about innovation, because there are so many needs throughout the world as well as in their local communities. And if everyone took a step with action to try to eliminate these different needs, we would be able to achieve a lot more global goals.
I think that's right. Now, what first introduced you to service?
It was, I think, back when I was very, very young in early elementary school, where during the holiday season, my family would purchase some gifts for other children within the town and bring them to the library. They had a gift drive. So I think that's probably when I remember realizing and thinking about helping other people. And then I grew from there, doing different service clubs in middle school and high school, and doing a lot of tutoring, so a lot of more education focused, as well as volunteering in a nursing home. So I think that was my foundation for service. And then I started thinking beyond the local community, but more on that global, international community during college and after.
Now, a lot of people in nonprofits don't like fundraising, and they view that as a big stumbling block. Now, how much money do you think you've raised to get your organization all around the world?
Well, each year we raise about $1.8 million in revenue. So over the past few years, probably about, or during the history of Unite for Sight, probably about 4 or 5 million total. Okay. And the fundraising is so important because that's how we're able to then fund outreach teams, fund local staff, and fund all of the surgeries for the patients who are living in extreme poverty and not able to afford the care on their own. Okay. And it's such a small amount, really $50 for each surgery that's being provided on average in these different communities. So fundraising is a very important component of the organization. So that
right, so if you're talking to these high school students or college students, or really anybody that says, I think I want to start a service project, but I don't know how to raise the money, and I can only do it if I was rich, very rich myself, or I could only do it if I was connected to all of these corporate CEOs, what would you say?
Well, definitely not needed. In fact, during the first 3 years, when just being a student organization, there was no funding. So we were able to do all of this matching of the patients in the community centers with these free health coverage programs with absolutely no money. And it wasn't actually until a year after I started expanding it that we opened a bank account. And all of the funding that we receive and use is specifically for our international eye care programs. But we were able in the first year to do about 25 cataract surgeries, fund 25 surgeries during the first summer program, summer of 2004, with just about $1,000. So we'd received our first $1,000 and had been able to do those small number of surgeries. And it was so thrilling to be able to know that the lives of those people had changed so significantly, and then from that early point we were able to then raise a lot more money and be able to provide a lot more services. So it definitely can start very small, and a lot can be done with very minimal resources.